Thank you so much. Muchas gracias. Yo puedo hablar inglés porque mi español es un poco malo. What I'd like to do today is take you to the places in the world where people are living the longest life and to share with you some of the lessons that we learned as to how they're doing it. Not only as individuals, but I think more importantly, how they're doing it as a community. There was a research out there that said that 80% of how long we live, 80% on how long you live, I live, is determined by lifestyle factors and our habits. Only 20% is genetics or healthcare. Well, if that's true, what we at Blue Zones wanted to do, I don't know if you can put up the presentation. If that's true, what we at Blue Zones wanted to do was travel the world to see if we could find the places in the world where people are living the longest life, where they have the lowest rates of middle-age mortality, places where they're reaching 100 at rates 10 times higher than they're doing it anywhere else, and more importantly, they do it with a fraction of the disease. Because if you ask me, it is more about the quality of life at times than the quantity. So our premise was if we could go to these communities and really kind of integrate ourselves into the cultures, really talk to the people that are doing it, we could create a de facto recipe for longevity. Next. And together what we were able to do is find the 5 demographically confirmed places around the world. We actually go there with demographers that are looking at birth and death records. We go there with physicians that are looking at, you can click the next couple slides. Physicians that are looking at birth and death records, demographers that are kind of following these people through 20 years or through 100 years of their life, as well as physicians. And together what we were able to find were the 9 commonalities. These 9 lifestyle traits that flew through all the different regions we traveled. We call them the Power 9, and I want to share with you what they are. But before I do, I want to take you to some of the places that we traveled. Next slide. And one more. Otra vez. We found our first Blue Zone in Sardinia, Italy. Next. And it's here where it wasn't the whole island of Sardinia, but it was this highland region, 14 villages, 40,000 people, and the highest rates of male centenarians in the world. Next, and one more. This is a place where at 102 you're still riding a bike. At 104 you can actively chop wood and beat somebody 65 years your junior in arm wrestling. The guy on the left is my brother Dan, my older brother. And I have to tell you, I always looked at him as my mentor until I saw him get beat. Next slide. Sardinia is a home of shepherds. These are people that, they walk every day for their jobs. They're not sitting down, but they move naturally every day. Next slide. Because of all their travels, because they're gone for days at a time, they had to come up with a portable food. An unleavened bread made from durum wheat, which is the same wheat you might find in a whole wheat pasta. Next slide. Cheese made from a grass-fed animal called pecorino, very high in omega-3s, the good kind. I can't hold my hand still. Next slide. And a homemade wine called Caninau. I have to tell you guys, if any of you like wine, there's nothing like the flavor of stinky boots, just to give that wine a little flavor. But we, working with National Geographic, were able to have this wine tested, and we found out that it had more of the polyphenols, the artery-scrubbing antioxidants, as any other wine in the world. They have actually a healthy relationship with maybe just 1 or 2 glasses a day, usually together with their family or friends in the evening. Next slide. They lived off of a plant-based diet, and fruits and vegetables that they grew in their own home. Next slide. Were they vegetarians? No, they ate meat. But it was that celebratory food. It was that food that they'd have after church on a Sunday. They'd come together as a community, and they'd sacrifice usually a pig. That's what we see common in most of the blue zones. But they'd only have meat about 4 times a month, and the portion sizes were about the size of a deck of cards. Next slide. But I think more importantly than the diet that they ate, more important than the exercise, it was their attitude towards aging. In most countries, the older we get, the less revered we are in our communities. But in Sardinia, the older you got, the more revered you were. You were repositories of wisdom for the next generation. It's a place when you grew old, you were surrounded by love. You were brought into the home. But they expected you to do more. They expected you to still contribute, to help raise the kids, feed the kids. Next slide. It's a place where in your 80s, 90s, even 100, you're still active members of society. Next slide. There's also something happening here. It's called the grandmother effect. Research shows us in households where one or more grandparents are living with the next generation, those kids are actually healthier. They have lower rates of disease and lower rates of mortality. So what you're creating is a virtuous circle, one where our adults are taking care of their aging parents, and just by their presence, that next generation is healthier. Next slide. We found our next blue zone in the East China Sea in the archipelago of Okinawa, Japan. Next slide. And it's here where you find the highest rates of female centenarians in the world. And these are, next slide, and these I think are the longevity all-stars. I think you just have to click it one more time. There we go. These I think are the longevity all-stars, starting with they have the lowest disability. They tend to live a long life, die very quickly at the end. There's a term, compression of mortality. It's that time between when you get sick and when you die. I know in America, it's about 4.5 years. It's when we spend most of our healthcare dollar, it's that time of your life when you need somebody to take care of you. In Okinawa, Japan, it was less than 1 year. They did the things that they want to do all the way to their end of their life. Next slide. They did it by eating a plant-based diet with fruits and vegetables, some that you know. Next slide. Maybe some that you don't know. This vegetable right here, very high in anti-inflammatories. It's called the bitter melon. Next slide. But I think more importantly than what they put into their diet, these people were masters of what they took out of it. I've had dinner with centenarians from around the world, but in Okinawa, when you sit and you eat with them, they always say the same 3 words: hara, hachi, bu, which means I'm only going to eat till I'm 80% full. They're controlling their caloric intake, and they have techniques set up to kind of reinforce it. Next slide. We know from the Framingham research that isolation kills. According to research, if you have less than 3 friends, you're defined as lonely. And the impact that has on your body is about the same as smoking 20 cigarettes a day. Isolation kills. Now, in Okinawa, what they do to fight isolation is they create these things called moais. When you're about 5 or 6 years old, your parents will put you in groups of other kids your age. They'll cultivate those relationships. So when they reach 20, they have the foundation to last a lifetime. Now, the reason I'm showing you this picture are these 5 women have belonged to the same moai for 97 years. They get together every night, they drink the green tea, they eat the soba noodles, they talk about the day's events. Next slide. They even argue about who that guy liked best back in 1939. The lady on the right, I asked her, what does the moai mean to her? And what she told me is, the first thing I do when I get up in the morning is I slide open my front door. And I look out to see whether or not my friends' doors are open. And if they're not, I actually go out and check on them. This is a culture that's growing old without the need of a long-term care nurse because they have the support networks built into the community that can help them when they're having a bad day. Next slide. They had a strong sense of purpose, embodied in the word ikigai. Here's a karate instructor still passing down the traditions that he's had that he's practiced and refined for the last 90 years. Next slide. A spear fisherman. Next slide. What gets him off his couch is to catch food for his extended family, 97 years old. Next slide. And if you don't think it keeps him in good shape, you're nuts. And the next slide. And this is Kamada-san. Her ikigai is her great-great-great-granddaughter. These two women are separated in age by 101 and a half years. Now, I got a chance to ask Kamada-san, how does it feel to hold somebody over a century your junior? And she said, it feels like leaping into heaven. Leaping into heaven. Next slide. One more. We found our third blue zone, this one in America. It's right in Loma Linda, California. It's right near LA. Next slide. As it turns out, it's a home of the highest percentage of Seventh-day Adventists. These are people that evangelize health. They evangelize a healthcare system. They celebrate the Sabbath on Saturday versus Sunday. Next slide. But as it turns out, on average, they're living 10 more years of life than anyone else in America. Now, how are these people doing it? These people that are living next to McDonald's and living next to all these unhealthy traits, how are they gaining every 10 years of their life, 10 more years of life than the average person in America? Is it their diet? Next slide. Or their genetics? No, it's not their genetics. If you look at an Adventist congregation, it's like a congregational melting pot. You have people from Hispanic descent, from European descent, from African American descent, from Asian descent. It's not their genetics. What is it? Well, for starters, I talked about earlier how they keep holy the Sabbath. From sundown on Friday to sundown on Saturday, doesn't matter where the kid needs to be driven or what they need to do. These guys check out. They focus on going to church in the morning. In the afternoon, they spend time with the rest of their congregation. Next slide. In the afternoon, it's taken right from their scriptures just to do a nature walk. Next slide. The definition of nature walk is not the same anymore, but they still spend time to let the stress of the week go and focus on what's important. They focus on their family. They focus on their friends. Next slide. One more. It's the home of Elmerth Wareham. Elmerth Wareham was 95 years old. When I met him, he wanted to build a privacy fence. So he started building it. Next slide. And he spent 3 days shoveling holes and pounding in stakes. 95 years old. And 3 days later, perhaps predictably, Ellsworth can be seen in the operating room. Next slide. He's actually the surgeon, not the patient. 95 years old, still did multiple open heart surgeries every month. Next slide. This is Ed Rollins. He's 106 years old, active cowboy. Next slide. Gets up in the morning, does a swim every morning. Next slide. And on the weekend, he goes water skiing. He's 106. And the next slide. Marge DeTon. Marge, 104 years old. She gets up every morning. She reads her Bible, eats the same breakfast she's had for years, oatmeal, nuts, and raisins. She chases it down with what she calls a prune juice shooter. I'll let you guys think about what that is and push that image out of your mind. She lifts weights. Next slide. Jumps on her exercise bike for 20 minutes every day. Next slide. Before getting in her car to go volunteer for 7 different organizations in her community, including, in her words, not mine, the elderly home. Now, Dan told me two things I always remember, or Marge told me two things. There's two things about Marge that I want to be clear with you about. I've traveled the world, but I have to tell you the most terrified I've ever been in my life was driving with Marge. And the second thing is we got to a stop sign one day, and Marge kind of slid over next to me and she said, "Nick, I actually feel sexier at 104 than I did at 103. Think about that. Is that what 104, is that what you imagine 104 feeling like? Is that what it should feel like? Next slide. And one more. My brother Dan wrote up these stories for National Geographic. Next slide. And we found, after that, the two last remaining blue zones that we've been able to find, one in the Nicoya Peninsula of Costa Rica. Next slide. I think one of the interesting things about Costa Rica is their public health and their system of public health, where every year three doctors, nurse, and a researcher will sit down with elderly people in these communities, and they'll actually do a physical, they'll do a mental health examination, and they'll go through your home to see if you have stuff in your refrigerator that causes diabetes. They'll look in your backyard to see if you have standing water that could cause malaria or the Zika virus. It's a way that they have that. Next slide. And Ikaria, Greece. It's off the coast of Turkey. Next slide. It's a place where I think Western civilization kind of passed on by, but they adhere to the Mediterranean diet in higher percentages than anywhere else. Next slide. One more. And one more. So it was here where I had my aha moment, and I think you guys will probably are already ahead of me. And it's this. I never met anybody on my travels that woke up at the age of 50 and said, I want to go on a diet so I can make it to 100. I never met anybody at the age of 50 who said, I want to go to a health club so that I can make it to 100. Longevity wasn't something that these people pursued. Rather, it ensued because of their environment. Next slide. I'm going to go through about 5. Keep on going. Keep on going. One more. That's it. No, one more even. So I talked earlier about the 9 commonalities that we found through all of our travels. Next slide. And there are these. These are lifestyle traits and integrated into your life can help you live longer, help you be happier, and in some ways, the first one was they move naturally. These are people who walk to school. They walk to their friend's house. They walk to their communities. They didn't have food processors when they made corn tortillas. Instead, they used the matate and did it by hand. These are people that, in Okinawa, you're getting up and down off the ground every day. You're getting that natural movement all the way through your life. The next slide is that second tier is a positive attitude. I have traveled the world, and I can tell you right now, no matter where you go in the world, they have the same worries that you and I have. They worry about money, they worry about their kids' health, and they worry about their kids, and they worry about their health. The difference is in the Blue Zone communities, they'd have these simple techniques to help reduce stress. Stress causes inflammation that's tied to most age-related diseases. And these are simple techniques, whether it was ancestor veneration in Okinawa, or praying in Loma Linda, or even doing a little nap. The next one is a strong sense of purpose, a reason to get up in the morning. As research shows, people that have a strong sense of purpose and can articulate that purpose actually live 7 years longer than people can't. The next line's around our diet. They had a little bit of wine in their diet. They lived off of a plant-based diet, about 90% to 100% plant-based. Legumes, beans, and magical fruit. They ate meat only about less than 5 times a month and fish less than 3 times a week on average in those communities. And the next one is they ate less calories than we tended to eat. And the bottom line is, I think everything that holds everything else up. They focused on their family. As you grew old, you're surrounded by love. They invested in their kids, which probably is not a bad thing to do as we're growing older. And they tended to stay married. They had a strong sense of faith. All but 2 people that we met had a strong sense of faith. 2 universities talked about how people that have a strong sense of faith and actually show up live 4 to 14 years longer. Those universities were Duke and Harvard. And the last one is our friends matter. According to the Framingham research, if your 3 best friends smoke or drink or are overweight, there's a 150% chance that you are as well. That health traits actually flow through a community in the same way a virus does. Now think about that. Are you healthier with that person that likes to go for walks and eat plant-based, or healthier with that person that likes to drink a lot and smoke? Our friends matter. But before you start thinking about what friends you're going to cancel out of your life, you also have to remember you need those friends that you can pick up the phone on a bad day and call, and they'll listen to you and support you. Just a couple more things I want to mention. If you can go to the next slide. In America, and I think in a lot of places around the world, what we focus on is diets. We focus on individual discipline. We say, you need to lose weight. You can go to the next one. You say, well, you need to lose weight. You need to exercise more. And we try to focus on the individual. Next slide. There we go. Perfect. But we find out that these, if you're trying to create a public health program, these don't work. Only 3% of the population can stick with diets. Only a small part can work out and keep with it, or even take daily medicine. So what we at Blue Zones are doing now, next slide, is what we try to focus on is the fact that 80% of what you do is within a 10-mile radius of where you work and where you live. And if you can optimize that environment to make the healthy choice the easy choice, then longevity isn't something we pursue, but rather it just ensues because of our environment. Now, what we do with our work is we focus you can just start clicking through these so I can tell you when to stop. We focus on the individual. We focus on creating, next click. We focus on creating social relationships that break down isolation in the communities. Next one. We focus on trying to give people a sense of purpose, a reason to get up in the morning. Next one. We focus on trying to look at the places where we work, live, play, and pray to create healthier environments where that healthy choice is the easy choice. Next slide. We try to look at policy and cultural norms around food, the way we eat, healthy access, food skills, affordability. Next slide. Tobacco, smoking, and next slide. And our environment's set up so that it's easier for her to walk, or there's safe places where we can come together as a community that give us purpose, that challenge our intellects and take it to the next level. Next slide. So, and then if we can layer on those Power 9 principles in there, we have a recipe for longevity. We don't go into communities saying this is what needs to happen. Instead, these are community-led initiatives. We will go in and we will listen to the community. We will try to understand what are the strengths, what are the real challenges that community has, and we'll bring in evidence-based solutions to try to change those environments to make that healthy choice the easy choice. We're in 45 communities around the United States, and we're seeing some really good luck. We're seeing, for example, in one community in California, childhood obesity has dropped by 65% in 6 years. Now, what does it mean if our kids are growing up healthier? In other communities, what we're seeing is smoking rates going down by 40%. We partner with Gallup to be able to measure this so that it's quantitative as well as qualitative. We follow our metrics with both process and quantitative outcome data to be able to do this. And again, what we're seeing right now in America is in one of our communities, we're predicted to save the community about $125 million in hospital costs, as well as in productivity in the work site. So one last thing I wanted to say, and if you just want to click through a bunch of them, I can tell you when to stop. Just keep on going, I'll tell you when to stop. So a couple of things that we learned through our work was there's 4 things that I think you need in order to really impact health. Number 1 is you need strong leadership in the community that has a strong vision around health. The second thing you need, and again, you can just keep on clicking. Just as fast as you can click them, keep on going. The second thing you think you need is resources, both financial resources as well as human resources in order to be successful. The third thing is you need a plan. You need actually a vision for the work that everybody can get around in a plan that's based on evidence, not just based on things that people want, but what is that evidence that is going to drive well-being. And the last thing is you need accountability. You need a way to be able to measure it so that you understand how are you having the impact that you want and the success, and you have to be able to hold everybody accountable to that work. So if you got anything out of my talk today, the heart of what I'm trying to say is that no matter what your community is, our environment has a huge impact on how long we live. Our environments being able to set up to make that default choice the healthy choice is important. We right now across the world are seeing obesity rates rise, skyrocketing in scary rates. We're seeing spending trillions and trillions of dollars being spent on diseases that are preventable. I know in America, and this one scares me, for the first time in history, the life expectancy of our kids is less of that of our own. And the reason is our environment has changed. You can't go to a grocery store. You can't sit around in a community without kind of being bombarded by those unhealthy choices. And individual discipline is good, but discipline is a muscle, and muscles fatigue. Eventually you break down and you grab that candy bar or that unhealthy action. The answer lies, in my mind, not with large governments and large NGOs. It lies with our communities in coming together in ways that honor our communities and honor who we are, to be able to use evidence-based practices from the people around the world that they emulate and integrate them into their life so that they can wake up one morning, look at that person lying next to them, and say, you know what, I kind of feel sexier at 104 than I did at 103. Thank you so much.